Hello, everyone. We'll just give it about like 2 minutes for everyone to kind of get settled in and join, and then we'll get started.
So good evening, everyone. Thank you for joining us for this Liver Canada and American Liver Foundation webinar on mental health and liver disease. So just get yourself comfortable, take a few deep breaths, as I know our speakers tonight are going to tell us to do very often whenever we may be feeling stressed or in need of that, just to calm ourselves down. So take a few of those deep breaths, perhaps put your feet up if you can do that. And now I'll turn it over to Ashley.
Great. Thank you so much, everyone, for being here today. Warren and I are excited to touch on such an important topic, maybe one that's more missed in the healthcare, especially the liver sector. So I'm the digital communications coordinator at Liver Canada, and I'll be co-hosting the webinar with Warren, who you just met. And this will be recorded, so you can see it on both of our websites as well as our YouTube channel after this as well. So just before we get started, I'd like to acknowledge the land in which Liver Canada is located. Liver Canada is located on the traditional territories of the Anishinaabe and the Haudenosaunee Mississauga and Mississaugas of the Credit First Nation. And we'd like to acknowledge and extend our gratitude and respect to all First Nations, Inuit, and Métis people for their valuable contributions. For those of you who may not be super familiar with Liver Canada, I'd like to just kind of give a little talk on kind of who we are, what we do. So Liver Canada was first established in 1969, and it was the first organization in the world created to help people with liver disease. We are committed to promoting liver health and improving the prevention, the diagnosis, and the treatment of liver disease in Canada through funding different research initiatives, education, our patient support, as well as advocacy. I'll hand it off to Warren to kind of talk a little bit about the American Liver Foundation.
Okay, thank you, Ashley. So the American Liver Foundation is the USA's largest patient advocacy organization for individuals with liver disease. So each year we engage patients as well as caregivers and our partners in the medical and research communities through our educational programming such as this, support our many support groups and support programs, and liver disease awareness initiatives. We're really pleased and excited that just these past few weeks, we have opened up our brand new non-directed living liver donor transplant registry. Now, it took me a long time to learn how to say that without stumbling over it. It's our brand new non-directed living donor transplant registry. And so what this registry will do, it will help those who are in need of a transplant who can utilize the living donor procedure to be connected with those who are willing to be living donors. And this will occur through their transplant centers. So it's really exciting. And at the end of our presentation tonight, we'll have both the Liver Canada and the ALF websites where you can go and look at all the initiatives that are happening on both sides of the border. So we're thrilled that all of us can reach across and us with our friends at Liver Canada. And as I said, we'll provide more information at the end of our programming for how you can follow up with this presentation.
Perfect. As for our agenda for the event this evening, We just did a little brief introduction, and then we're going to have our patient speaker, Stephanie, share her story with liver disease. For events like this, we try to have a patient perspective as well as expert perspectives. So after this, we have a panel Q&A style where Warren and I have gathered frequent questions from patients to our patient support teams as well as support groups, and we're asking the experts those questions. And then if time permits at the end, there will be a Q&A where everyone can drop questions in the chat if they have any, and our experts can get to those questions. And then at the end, just a quick poll to gain your feedback on the webinar. Just before we get started, if everyone can just stay on mute for the rest of the webinar, that would be great. And then drop your questions in the chat, as I previously said, if you have any.
Okay, so our speaker this evening, first we have our patient speaker, who is Stephanie Azzarello. Stephanie is an art historian and organ transplant recipient. She'll tell you a little bit about that. In 2013, she was diagnosed with PSC, and in 2024, she received a life-saving liver transplant from a living donor. Between those two events, she got her PhD from Cambridge University, made lots of friends. She lived in Italy, and she is just enjoying her life, which is wonderful. She lives in Toronto and teaches in the Department of Art History at the University of Toronto. Secondly, we have Dr. Anali Patel, who completed her doctorate degree at Wright State University School of Professional Psychology. She completed her fellowship in adult organ transplant at Indiana University School of Medicine. Her clinical specialties include health psychology, adult solid organ transplant recipients, and organ donors. Her research focuses on the psychosocial well-being of patients who are post-transplant, which is what makes her an excellent person for us to hear from tonight. And thirdly, Karen Trainoff is a registered social service worker, registered dietitian, and positive psychology practitioner. She spent over 20 years helping people who are living with major health challenges and the caregivers who support them. We always try to include those caregivers in the support. And she's helped them navigate life after diagnosis. Her practical evidence-informed approach combines compassion with real-world tools that make a difference in daily life and daily living. Karen is passionate about helping people manage difficult emotions, to build strong and reliable support systems, and to find a sense of resilience and stability, even when life feels uncertain. And my goodness, when does life not feel uncertain? So definitely something. So I want to thank our speakers for all joining us and giving their time for us tonight on this very important presentation.
Perfect. So now I invite Stephanie to unmute herself and share her story with liver disease and how it's impacted her mental health.
Thank you, Ashley. First, I'd like to thank Liver Canada and the American Liver Foundation for inviting me to speak and give my perspective today, because as I think many of us on this call are aware, mental health is something that's often overlooked, and certainly when you're dealing with something like liver disease, which is very serious, that usually takes front and center. But I would say usually to the detriment of your mental and emotional health. You know, your psyche can be just as sick as your liver when you're trying to navigate liver disease. So I'll just start by saying a little bit about myself because I think the most important thing is to just try to talk about how I've coped. Long story short, I was diagnosed with PSC in 2013, and I will be very honest, I didn't want to talk about it. I didn't want to think about it because it was gross and weird and scary and rare. And I do remember the doctor saying to me, well, you know, we don't really know a lot about it because it's really rare and people aren't really looking into it. And I'm not sure whether that was supposed to make me feel better or him feel better. Um, but all of that is to say, I immediately went home and the first thing I did was Google it. So my first piece of advice would be don't Google anything. Talk to a medical doctor. And actually, after Googling PSC and the kind of rudimentary stats that the internet will spit out, it was almost in that moment that I decided, okay, going forward and having to navigate this because PSC, primary sclerosing cholangitis, has no treatment and no cure. So that means you have to monitor it and you just have to watch and wait and see how it develops. And so I decided in that moment I was not going to Google anything. And as I speak tonight to people listening on the call, I do try to keep in mind that I can only talk about my story and my situation and the things that worked for me. So I understand that not everything is going to work for everybody. But I found that not Googling things and only getting medical advice from my hepatologist was the thing that helped me navigate navigate um, navigate my journey with liver disease. So that was the first thing. And then again, I'll be honest, I didn't want to talk about PSC, and that's for a few reasons. First of all, there was no one to talk to about it. I think it's come a long way since I was first diagnosed, and there are more support groups, and there are more forums and internet societies to join, and that's wonderful because when I was diagnosed, there just wasn't that community, and so instead, I decided I would throw myself into doing things that made me feel like me. I will say that I never neglected my health. I always made it a priority to go to my doctor's appointments and check in. But then I decided that when I wasn't at the doctor's and I wasn't checking in, I was going to live my life. And I remember my hepatologist said to me, he said this thing that stuck with me and stayed with me, and I still carry with me today, even post-transplant. He said, "You are not this liver disease. You are a person with liver disease." And something in that moment shifted because I realized, yes, I am still me. There's been this weird development in my body, but I am not PSC. I am not this liver disease. I am a person with PSC. And again, I don't know where people are on their journey. I imagine there might be people on this call with PSC, people who are pre-transplant, people like myself who are post-transplant. And the truth is, there's no cure for PSC. So a transplant, whether I want to recognize it or not, is a treatment, not a cure. But I'll take it. I'll take it because it is a treatment. And so that having been said, I still technically have PSC, which means I keep reminding myself I'm not that disease. I'm a person with that disease. But now I have a healthy liver. And so again, the thing that I would do over and over and over again for myself while I was living my life was doing things that made me feel like me. So that for me, that looked like earning my PhD and traveling through Europe, reading books, seeing my friends, and yes, going to my doctor's appointments because that was non-negotiable. I felt like, okay, you know what? I'm going to make a little deal with myself. I will go to all my doctor's appointments. I will do all the tests they ask me to do. I will take medication if they need me to do that. And in exchange for that, I get to live my life. I get to do the things that make me feel like me. And so that carried me forward up until it became clear that I needed a transplant. I mean, that's the other thing with diseases like PSC and sometimes PBC and autoimmune hepatitis is they can remain relatively stable or dormant, which you think is okay, but it actually kind of tricks you because I'll be honest, I got tricked. I was so busy living my life that I forgot that I had it, which again is why seeing my doctors, staying in touch with my medical team was so important because then when things started to change, and they did very drastically in 2019, we started to kind of read the tea leaves. And so the idea of transplant was on the horizon, but because it was something that I maintained, even if it was in the back of my mind by going to my doctor's appointments, for me, I'll be honest, hearing the words, "It's time to list you for transplant," I'll be honest, it didn't actually feel that scary. Yes, I recognize it is a huge procedure and it means a lot of changes. But I'll be honest, I actually felt extremely hopeful because I thought with this transplant comes the possibility of sustained relief. And yes, I'm on the other side of transplant and I'm so grateful. And I'm someone who very thankfully received a non-directed living donation, which means my donor was a stranger to me. I mean, now she's literally my blood and I love this woman, but I didn't know her before transplant. So all of that is to say, I knew that that would change everything. And now it's a different set of things you have to keep in mind. You know, it's daily immunosuppressants and it's monthly blood work and it's keeping in touch with your transplant coordinator. But regardless of whether you're on this side of transplant or you're waiting for a transplant, or maybe you may never need a transplant and you are just living with liver disease, the one thing I want to stress is whenever you can, remind yourself that you are a person and you are not your liver disease. You are not your liver. You are not your lungs. You are not your kidneys. You're not your heart. I mean, these incredible organs, you know, you come into the world with them and they just know what to do. Okay. You leave them to their own devices and they will just know what to do. And sometimes, okay, you have to course correct. But think about all the time you never spent thinking about your organs. You never spent thinking about your liver because it just did the amazing 500 plus functions. The only difference is now, okay, you're aware that you have to keep in touch with your doctors and you have to be mindful. But regardless, just because your liver is struggling or, you know, you're inactive liver failure or you're just newly diagnosed, you are still whoever you are. That has not changed. That has not changed. You know, things might change in your external world, things might change in your inner dynamic with your inner social circle. But again, the one thing I really want to stress is you are not your disease. You are a person with this disease. So, what are the things that make you feel like you? And it doesn't have to be something as grand as doing graduate work or traveling, or it can just be watching your favorite television show, eating your favorite food within reason. Talk to your doctors. I cannot give medical advice, but all of that is to say, do things that bring you joy, even just little moments, even if it's just a fleeting spark of light in the darkness. Those are those little things that will become the constellation that keep you going. Don't discount a moment of joy, you know, because when things get very dark, you have to remind yourself that there are moments of light and there will be more light. So again, you are not your liver disease. You are not your liver. You are still who you are. So find the things that bring you joy. That's what I did. And that was the panacea that my mental health needed and still needs. I still actively do that. Just because I'm on the other side of transplant doesn't mean, you know, everything's magically better. But it's every day finding joy, even just a moment, even just 1% in your day. And those little moments build. I promise. I know you may not believe me, but I promise you they build and they build and they build. So again, if I can leave you with anything, it's that you are not your liver disease. You are whoever it is you are. And that's up for you to define and think about it like an opportunity to define yourself however you want to, but you're not your liver disease. So please remember that.
Great. Thank you so much, Stephanie, for sharing such a motivational speech and topic and giving us great advice. I know this will resonate with both of our communities in America as well as in Canada. So thank you so much for that. Um, on to the next portion. We're going to start asking the experts common questions from patients that both Warren and I have received. So I invite the
Okay.
experts to unmute themselves.
Okay, this is my favorite part where we get to grill the experts. So we're going to start with Dr. Patel. Doctor, how is mental health impacted by a chronic disease diagnosis? And for our purposes here, liver disease, especially in those earlier stages when it's
Mhm.
brand new.
Yeah, that's a really good question. And I usually start that question by telling people, or that answer by telling people, that there is a really, really strong connection between your mind and your gut. And what your gut is your intestines, your stomach, your liver, your pancreas. I mean, it's not like you might be feeling your pancreas, but that sensation that you feel when you're nervous, the butterflies in your stomach, that's your gut sending signals to your brain saying, hey, something's going on. So mental health and chronic disease, they go hand in hand, where when something is happening with your body, a lot of the times, maybe internally something is not going well, or something feels off. Um, so what I tell a lot of people is, initially when you get a diagnosis, there might be a lot of anxiety, processing. Stephanie, I think you shared with your story as well that you didn't want to think about it. I think that that's very common, and that's a mental defense that we have, a protection, a mental protection that we have when we get bad news or news that surprises us. I think that mental health impacts your physical function. Mental health changed, by your social interactions. If you're not feeling well, you're not going to be able to do the things you want to do. You might isolate. You might experience stigma. You might have questions, like Stephanie had said, like, what does this mean for me? A lot of new questions can create confusion, depression, anxiety. So, all of that to say, very normal, very, very normal.
Great. And as a follow-up to that, Doctor, and this is specifically, right, we know in terms of liver disease, how can patients cope with the stigma and the assumptions around a liver disease diagnosis?
Absolutely. I also get that question a lot too. There's a lot of stigma. There's a lot of misinformation out there. And I would say a lot of the language that we use in our society doesn't really bode well for people who might be experiencing mental health concerns or liver disease concerns. Stigma and assumptions create guilt, isolation, and in and of itself can, like I said before, create anxiety, depression, all of those things. What I tell patients and caregivers is, approach it with a sense of curiosity. Pretend like and this might be silly, but pretend like you're discovering something new, and you're just gathering information. You're just trying to figure out what's going on. That same attitude can also help with people who might be a little bit more questioning of what's going on with you. I tell people that open and direct communication, explaining how symptoms actually impact them, humanizing it, making it a little bit more personal, can help with that stigma, can help with that assumption. Like, hey, liver disease is not something you do to yourself. Nobody I know is asking for this. This is something that is happening to my body, and this is the way it's impacting me. So, kind of focusing on the impact of that and humanizing it for that person. And then for yourself, I also say for people to also practice self compassion, affirm your worth. You are deserving of treatment, whether or not, the belief around your disease process is something you caused or didn't cause, or a lack of action caused your process. That doesn't matter. What matters is getting the appropriate treatment and deserving that treatment, believing that you deserve that treatment. Um, some of my patients also find a lot of worth in advocacy, sharing their story. Again, that idea of humanizing it, putting a face to it, saying, hey, this is actually what liver disease or chronic disease can look like. Leaning on your support team, your healthcare team, saying, this is how I'm feeling about this. Have you encountered this before? I also talk about, in healthcare, our language is changing. Instead of saying non-alcoholic fatty liver, we're calling it metabolic disease. Calling it a fatty liver or calling it non-alcoholic, that language in itself, those words have a lot of weight to them. Metabolic kind of describes a little bit better of what's going on with the liver. It's a metabolic disease. So even helping people educate, understanding the terminology that they use can help with that stigma as well. So I think what I like to end on with this is go with a little bit of curiosity, a little bit of openness, practice self compassion, and also remember that you have the right to treatment despite what anybody else thinks. It's important that you get the treatment.
Great. Thank you. Next, this question is for Karen. How can I manage the fear or uncertainty that comes with a chronic disease diagnosis?
Oh, such a big question. And first, I just want to say that fear is normal and it's expected. This is something that would, I think, be weird for most people if they didn't experience some level of fear and certainly the uncertainty of what comes with a diagnosis like this. And so when that happens, and I just wanted to also to say thank you to Stephanie for sharing her story. And I think it's just so very important for us to hear. And I suspect that many of the things that I would have liked to have shared tonight, you've already shared, which is so important. And so thank you for that. And having that shared from somebody who's living with liver disease and has been able to find a way to share very practical things with other people and us as practitioners, thank you so much for that. So I just wanted to say that. And in terms of the how can we manage the fear or uncertainty? There are certain things, there are some practical things we can do once we acknowledge that fear is normal and expected at the beginning. But there are things that we can do. And these are things that I see and work with clients that I work with all the time that have been um, very impactful. And I will say just for transparency, I come to this world also with a lens personally as a caregiver. So I want to be able to share that. And I know that for me and for the other caregivers that I work with, as well as people who are living with chronic disease, these tools are interchangeable from within both groups because fear goes all the way around. It's shared by people who love the person as well, oftentimes who are living with the disease. And so something like finding anchors of stability is something that I find helpful for people. And what I mean by that is basic things. They sound little, but they're cumulative. They actually add up over time. So something like, if you enjoy a morning cup of tea, that ritual or routine of just making that tea, if that's something you did before your diagnosis, finding those things sort of much along the lines of what Stephanie said. And, she went and got her PhD and did wonderful, amazing things. And she also shared that there were sort of the big things and the small things that sounded like they made a difference for her. And so building on that, I'm talking about those small things right now, that cup of tea, the things she talked about bringing things that bring you joy. They can also be things that maybe you don't even think of as joyful, but are something that you find familiar. And that familiarity can be very comforting in a time where everything else seems upside down. And so that uncertainty starts to get balanced when we find things that are familiar to us. So that's what I mean when I talk about anchors of stability. So it could be your morning tea, a walk with a friend, taking the dog out, whatever it is, those small things are those anchors. The other thing that I like to talk to people about is this idea of sort of presence. What is it that you can do right now? So oftentimes when we get big news that really upends us and it causes this fear and this uncertainty, our minds, it's just human nature that we're going to start to spiral forward with all of the what ifs. And again, Stephanie, thank you for that sort of staying off the Dr. Google because that oftentimes not a help for most people and can really feed that anxiety that comes with this fear of an uncertainty. And so really sort of pulling it back into the present moment. What is it that I do know right now? What is it that I need right now? What is it that's happening in this exact moment? And that moment could be this week, this day, this hour, or this minute, or even this second. So, and that can change over time. So maybe at the beginning, all you can manage is what is it that I can manage, or what do I know I need right now in this minute? And maybe in a few days, you can deal with this hour, or this day, or this week. And so just pulling it back and finding ways to bring you back so you can stop the spiral of the what ifs. Um, and the other thing I just want to mention is that there is a way to pair sometimes fear with action. So, what I mean by that is when you feel afraid, sometimes, and the uncertainty just seems to overwhelm, that maybe even a small action, like if you're putting off calling the doctor or you're putting off doing something that just feels really uncomfortable for you, understandably, sometimes just making that move to do that can pair that. That's what I mean by pairing. So small actions, whether it's related to your medical situation or not, it might be paying the hydro bill, whatever it is that maybe there's an action that you can take that you feel good about, sort of checking off a list, that can sometimes pair that fear and sort of it it balances it out sometimes. So I'll leave it there for now.
Great. Thank you. The next one I have for you, Karen, is what steps can I take to process or accept my diagnosis?
Mm. Well, first of all, I think acceptance doesn't mean you have to like what's happening, first of all. So just, that may be like I may be stating the obvious, but certainly when working with people who've just received a diagnosis or somebody they love has just received a diagnosis, often they'll think that they need to accept it means by accepting it means they have to like it. That is definitely not the case. We don't ever have to like it per se, but there is a sense of being able to accept what's happening in our lives and what's happening in our bodies. And we can still be like, I'm going to give that a thumbs down in many ways, but I'm actually going to, again, Stephanie, I hope you don't mind that I'm just coming back to things that you said, being able to separate ourselves from our diagnosis is part of the process of being able to accept what's going on in our life and allow us to actually live our lives with whatever is going on around us. And so I think, it's such an important piece. I was making some notes while you were talking, so it just was so powerful, being able to live your life. And other things that I think we can do is really finding what's true. So for example, being able to say to yourself, I have this diagnosis and I'm learning what that means to me. That's it. It's a step. It's a first step into figuring out what that looks like. You don't have to have it all figured out at the beginning. You don't have to have it all figured out ever. Whoever has all the things figured out in life, really. But being able to say, you know what, I'm learning, I'm living with this, I'm living through this, and I'm going to figure it out. The other thing to, be able to think about are the things perhaps in your life that you actually do have some control over. I think can be very helpful, and especially in those early moments and times, and being able to say, you know what, I can control how I'm going to put the dishes away, or it can be small things, but focusing on those things that we can control can help us move away from sort of that need for acceptance about all sort of these big questions and things that are going on in our life. So I'll leave
Great.
it there.
Thank you.
Thank you. Just Karen, before I ask Dr. Patel this question, before you mentioned paying the hydro bill. Now, for those of us south of our border, that would be the electric bill, would it not?
Yes. Yep.
Okay.
Yes.
I,
Thank
I
you for
just
the
I just want to clarify that very technical term for
yes,
those of us in the States.
yes, the cross-border translation.
Yes, I
Electric
want to
bill.
make sure we all
Yes.
understand what we're all on the same page. Okay,
Yep.
that's the electric bill.
Yep.
Okay, Dr. Patel, are symptoms like mood changes, memory issues, or confusion common in liver disease? And if so, what are the keys to trying to manage it?
Yeah, I joke with my patients because yes, absolutely, and that's kind of why I have a job. That's really what a lot of my focus is. So, like I had mentioned before, right, that very, very strong connection between your gut and your brain Mood changes can be due to a number of factors. So I can go into those a little bit deeper, but really the main things, physiologically, we know that the liver filters out toxins. It's also responsible for, I think Stephanie had said, over 500 metabolic functions. It also releases and controls hormones, which include stress hormones, sleep hormones, sexual hormones, all of these things. When that is not working properly, it's sort of like the powerhouse. It's the secret powerhouse that's kind of going down a little bit, and your body is trying to figure out what's happening. So the way that manifests is memory loss, confusion, maybe like a brain fog, or feeling, not totally with it all the time. That's what patients kind of describe to me. That can also impact mental health, and that has a direct correlation to anxiety and depression. If you're not feeling like yourself, it stands to reason that you're probably not going to feel super happy or super great about what's going on. The other thing I say is, the pain, the fatigue, nausea, vomiting, all of those things that come along with liver disease, that can also change your mood. You might not be eating or sleeping like you normally do. So your cycles are off. Your hormones are off. And then that all might lead to lifestyle changes. Different medications that you might be on to manage the liver disease, to manage pain, those can also impact mood. I know sometimes some of our patients are on high doses of steroids and things like that to help control some of their symptoms, or they might have a lot of itching because of the jaundice or the liver, and they might have jaundice. So like that can also cause mood changes. Liver disease can cause changes in lifestyle. And again, when someone is facing a lot of uncertainty or a lot of changes really quickly, it can be overwhelming. So all that to say, absolutely, very common, very, very interconnected. The things that we can do to manage them, there are a lot of good things. And Karen and Stephanie I know I keep going back to them as well, but you guys have already talked about so many things. So that was actually the first kind of coping skill on my list was anchors. Karen, I think you had talked about finding anchors, finding things that you are in control of, even if it's small things. Okay, I got out of bed today and my pain was a little less. That's a win. That's a little bit of a win today. Maybe tomorrow my pain might be a little bit more, but today the pain is manageable. That's something that I'm excited and I can anchor myself in that. Finding things that matter to you, finding what still sparks joy when your lifestyle has changed. Some really practical tips that I have. So, for memory loss, confusion, things like that, what I tell patients and the care team alike is start taking notes. A lot of my patients will carry like a tiny notebook or, like a Post-it, a pack of Post-it notes. If there's something important that they don't want to forget, they'll jot it down. That way, you don't have to feel bad if you did forget about it. The other thing I tell people is sometimes it's helpful to have like a calendar, a whiteboard, something like in a common area where, family can see it, care team, we can see, okay, here are appointments, here are the medications we're taking. Oh, we have so-and-so's birthday next Friday. We can't forget that. That's always visible, something that everybody's collaborating on and we're talking about it. So we're kind of keeping it in focus. Having alarms on our phones, computers, tablets to remind us for things, keeping a consistent schedule, and that also includes pill boxes. Again, these are all tools to kind of help with your memory. The more rote and routine things become, and the more often people rehearse them, the more likely you are to remember them. So if we're counteracting some of the stuff that's out of our control, like the liver disease, these are things that we can do in our home, or ways that we can kind of change our behavior a little bit to hopefully help with that memory and confusion. The other thing I just like to tell patients is be honest with your care team about your concerns, and examples are really helpful. So if you have trouble, remembering things, give examples of what has been difficult, what is hard, what has been different for you. The one caveat I say is absolutely seek medical attention with any sudden changes in confusion, drowsiness, slurred speech, trouble with coordination. That would definitely be a time to call emergency services. But if you're seeing kind of changes as someone or your loved one or even yourself as your disease progresses, it might be helpful to kind of talk about with your care team about what other supports might you might need in place to kind of be successful with some of these things.
Okay, and now that we're going to shift a little bit with this question here, what psychological signs should caregivers or
Yeah.
family members be aware of in their loved one who has liver disease? What would be a signal to them say, oh, okay, this is different?
Yep. Yeah. So I have three areas I really focus on with patients when I'm talking with them. I'm talking about mood changes. I'm talking about cognitive changes. So, cognitive is the way you think or kind of your memory, things like that. And behavioral changes, the way that you're acting. So, the mood changes, what I'm really looking for a lot of times with patients or what they're kind of describing to me, first feelings might be anger, irritability, denial, a lot of these feelings that might be coming up with an initial diagnosis. Anxiety doesn't always look like jitteriness or always on the move. It can look like feeling like a loss of control, feeling like something bad is going to happen every moment, racing thoughts. It can look different for everybody. Depression could be crying, low mood, feeling like you don't really care about things anymore, sadness, feeling like there's no hope. Those might not necessarily be visible outwardly, but they might be what you're feeling inside. So that could be something where you say, hey, this is different. This is different than what I've been feeling before. The cognitive changes, kind of like what I was talking about before, confusion, trouble following conversations, forgetting things. Again, some may be related to your liver disease, some may be related to other comorbid medical conditions. So, for example, sometimes patients who have high or low blood sugar might experience memory concerns or feelings of anxiety that look very similar. So then I also talk about behavioral changes. So, what people actually do. What that might look like is social isolation, feeling like a loss of independence. It could be physical changes, not being able to be as active as you once were, maybe having pain in places you didn't have before. So, it makes everyday activities a little bit more difficult or different. The other two things I talk about are sleeping and eating changes. Those are really, really big. Usually, those are the first clues that something is going on with your body. Even if your mind hasn't caught up quite yet, your body might say, ooh, we want to eat a little bit more, or we're sleeping a lot and we're still really tired. That's something that's different. That's something that we should look into. So, really, what I say is anything that looks different, anything that looks like it's out of the ordinary, or anything that feels like falls in those categories of the mood changes, any cognitive changes with thinking patterns, and then any changes in that person's behavior. Are they, retreating more? Are they acting differently? That might be cause for a little bit more questioning.
Back to Karen, we have another question for her. How can I cope with feelings of isolation or frustration related to my diagnosis?
Mm. So again, much like the anger and the uncertainty, or the fear rather, and the uncertainty, isolation is common. It's just so common. I hear that all the time where people say, people just don't get it. I just feel so alone. People totally don't understand what I'm going through. So it's so common. So I think firstly, just being able to acknowledge that this is a common and somewhat expected feeling when you receive a diagnosis of a chronic illness or something that is again just really may have turned your life upside down. But there are things that you can do for sure. And I just want to preface what I'm about to say, and it goes for everything that I'm saying, which is, again, they may sound, I in no means intend for them to sound glib or easy, or they're not. I totally understand that. What I will say is, after many, many years of doing this type of work, what I do know is that these little things, whatever you pick and choose, and it's like a menu, you can pick and choose things that feel right for you. they do add up over time. And I think I said that earlier, they do add up over time and they can make a difference. So it's a matter of finding what works for you. This isn't me trying to suggest, oh, just have a bubble bath and it will be fine. That's not at all what I mean. It's finding those little things that work for you. So in terms of the isolation, one of the first things that I like to talk to people about is being intentional about how they connect. So what do I mean by that? It's about connecting. For example, tonight is a way that whoever has joined us, and hello to all of you who are there, you've made the intentional choice to join us tonight. You are part of something beyond just you. You are part of a group that has some kind of shared experience. You are part of something. It may not be the group you would have chosen to be part of, but this is where we are today, and it allows you to be part of something. So whether it's a support group or information groups like this, or any kind of thing that makes sense for you. Support groups aren't for everyone. Some people love them, some people don't. But whatever that connection is for you, and it's worth giving a try. Like little things. If you try it once, it's not for you, try again, maybe yes, maybe no. But making it intentional about how you want to connect. That goes for people also in your life. People around you who may not get it. That's true. They may totally not get it. But being able to say to them, hey, I feel alone. If you feel safe to say that to someone, I'm feeling alone. I'm feeling isolated. I could really use a Zoom call, a phone call, a coffee, whatever it might be, to connect with somebody intentionally, somebody that feels safe for you. What I'll also say with that is to try and avoid the energy vampires. So those are the people who really are just, an energy suck in your life, and they're not adding that energy in. And and again, everybody can correct me if I've got this wrong, but I suspect many of you don't have extra energy to give away emotionally right now. And so if that's the case, be mindful about where you're giving your energy and to whom you're giving your energy. And so being intentional about that as well can help you feel less isolated, because giving that energy out to people who are just taking can really amplify the feelings of being alone and isolated and feeling misunderstood and not seen. So being around people who fill you up rather than empty you out, I think, is an important piece of it. And the other piece I just want to mention here, and again, just going back to something Stephanie said, which is to revisit your own identity. Who are you beyond your diagnosis? Because while other people and groups and things can definitely help us feel less isolated, we can actually do that for ourselves too, if we're willing to kind of take a look at who are we. Because a diagnosis of any kind actually doesn't, I have not found any kind of diagnosis yet that has taken away somebody's strengths in their character or their passions. They may have put them on hold, some of them for a bit, but they're there. And who we are at our core is there. So sort of peeling back the layers of the onion to kind of get in touch with who we are can help us feel, even though we're not with other people, more connected to who we are beyond our diagnosis, if that makes sense. So yeah. Yeah.
Another one for Karen. How can I balance taking care of my mental health while also managing the demands of my physical health? For example, doctor's appointments.
Yeah. So I'll say this. I think, as somebody who, as a dietitian and as a psychotherapist, some being able to deal with sort of the physical, the mind-body connection is a big piece. And having to manage that when you're dealing with a physical illness that has, mental health mental health implications for sure, understandably, is complicated. Again, I'm stating the obvious there, and that's why I guess we have this question. I will say this: our mental health and our physical health, when we can look at them almost like teammates as opposed to having to like pick one or the other, I think it just for a lot of people when we talk about that can be helpful in the sense that both pieces we're one person. We're not just our mind and or just our body, and we're one person. And being able to kind of think about how can I balance that. There are very practical things we can do. So, for example, um, we have a million appointments or things that you have to do and for your physical health. And being able to, if you can, and it's not always possible, but if you can, for example, creating a buffer time on either side so that you have time to emotionally kind of prepare for what you're about to do. Some people don't love that emotional preparation. They're just like to hit the road. If that's better for you, then being aware of that. But it's about being aware of what works for you. If having a little bit of time to sort of ground yourself before you go into an appointment, it can be as little as 1 or 2 minutes of a few deep breaths before you go into an appointment that may feel um, like something that's causing you a lot of anxiety. That can help to sort of diffuse that. So you're balancing the physical by going in into making sure that you are getting your physical health addressed, but at the same time being aware that your mental health is being impacted. So having that buffer where you say to yourself before you go in, I'm going to take just a couple of minutes or a couple of seconds even to take a couple of deep breaths before I go in. I'm going to help to calm my mind. I'm going to help to ground myself. And to be able to do that in a way that allows you to be clear before you go in. And there's a few kind of reset tools. So it helps us to reset. The same thing when we come out. We can do the same thing where we sort of unload some of that the same way, and we can reset our nervous system that is all might feel a little bit activated by these kinds of appointments or other things. So being aware of that. So I'll give you one that I think works well. It's a little practical thing that I use in my life all the time. I use it with clients all the time. And some people love it and some people don't. But if you try it, most of the time people will say to me after, oh, that in a moment that seemed weird, that worked. And it goes like this. You can, if you're sitting somewhere or you're standing, it doesn't matter. And you start to feel that anxiety that starts to build. We feel it. It is a physical response. We're having it in our bodies. We feel it. Our heart rate is starting to increase. We're all of the things that go with potentially with feeling anxious. You can say to yourself, ask yourself this, where are my feet? Where are my feet? And in that moment, it's a bit of a trick in the brain where it just stops the cycle of sort of this panic that may be starting or the anxiety, and it has you focus on where are your feet. In that moment, all you have to do is think about where are your feet. Right now, I'm very short, so I'm sitting with my feet on a stool. I'm thinking about it. My feet are on the stool. I have a pair of shoes on. They're flat. It doesn't matter what's happening with your feet as long as you're thinking about as many details. Where are your feet? And in that moment, it is that connection between the mind and the body. We are connecting them. They are all one piece, and we are doing something for us to help us to feel better as we're going to do things that may feel very hard. And maybe it has nothing to do with your going into a doctor's appointment. It may catch you at Costco or somewhere else where you're just the weight of everything that's going on in your life starts to feel overwhelming again. And I think that's where we can balance those physical and those mental health needs at the same time. So being intentional about what we're doing, having those little tools, the deep breathing, um, you know, telling yourself this too shall pass as you're taking 2 deep breaths. We can do that. Deep breath in, deep breath out, deep breath in, deep breath out. That's all it takes sometimes for us to reset our bodies and our minds at the same time. So I will say this also, one last piece on that is again, is that self-compassion. And um, that's a biggie. And when we can be kind to ourselves in that moment, and we can say, I'm doing what's helpful. It might not be perfect, but I'm doing what feels right for me in this moment. Good job. Good job. And being kind to ourselves can help us again to balance that mental and that physical need for us.
Wow. So as we come here, moving now toward the end. So Dr. Patel, so how would you suggest that patients approach this topic with their care team when they are feeling some of these, issues that are affecting their mental health? And maybe we'll get Karen to answer on this too. Is that how do patients find people like you? We have different healthcare systems in Canada. So the way patients may be able to find and to connect with people like you. Maybe each of you and Dr. Patel will start with you with this question here, but then Karen, maybe in a moment you can let our folks know how they could connect with somebody like you as well.
Yeah. So I always tell my patients, you don't have to tell me exactly what's happening. You can just tell me that you don't feel right or something is off. And I think that is maybe one of the first steps in kind of trying to get help, is recognizing that something isn't feeling right, or there's something that I can be doing a little bit better. And usually, if you tell your care team something isn't right, that's a cue for them to kind of start asking a little bit more questions, or, kind of probing a little bit more. So even if that feels like that's all I can get out, that's pretty good. I would say that's really good. The second part of that, I would say, is try to figure out and track your symptoms. What feels different? What isn't working well? What is happening? And that might be also a good way to talk with your care team. So if you start tracking your symptoms, that can be a very tangible way to then explain to them what is happening to you. So I always tell patients too, you never have to tell me, the clinical terms for anxiety, depression, even if you don't know if that's what's happening, or, you're just saying, hey, something isn't right. What your physicians or your doctors or your care team, what they want to hear is, how is it impacting you? So, for example, what I tell people, a good example of clear communication is, I'm not sleeping very well. Last night I slept 12 hours, but I'm still feeling very tired. Or, I've been crying a lot and that's not really normal for me. And I just don't really feel good. I can't stop thinking about certain things. That might not be, anxiety or depression, so to speak, but that's actually the real world of like what's happening to you. And then that can give your care team a little bit more information of, okay, let's go down this path and investigate this a little further. How is this symptom impacting you? So what does that mean? Really, the important thing that I'm looking for, and I think a lot of care team members are looking for, is how is this impacting you and what can we do about it? So telling them what's going on with you is helpful, even if you can't say it's mental health. Sometimes I tell people, with isolation, you can even say, I just haven't been outside of the house and I'm really upset about that. I don't like that I haven't been able to leave. I feel isolated. That can also be a different way to explain that you don't feel very good. The other tips that I tell people are, setting small, realistic goals. That can also be a way that you can kind of approach it with your team. Hey, I know that there's a lot of things that we're talking about in our appointment today: mental health, physical health, new medications, perhaps, whatever. Let's pick an area and focus on it. Let's pick sleep. How can we attack sleep? Kind of like what Karen said, how can we attack sleep from a physical perspective? How can we attack sleep from a mental perspective? Let's make sure we're kind of talking about both. The other thing I tell people is, bring a support person, bring somebody that knows you well or might be able to help describe these things if they're hard for you to talk about or hard to verbalize. Sometimes the people that are taking care of us can see the differences a little bit differently than we can. We're feeling it, but they're seeing it from their perspective. I used to be a lot more active and I used to want to leave the house more, but now I'm not really feeling like that. I might not recognize that right away, but my spouse who's taking care of me might be like, wow, she hasn't really left a lot. That's different. We should talk about that. So part of this is also leaning on our support team to kind of help us if we're not feeling comfortable talking about this topic. Lastly, if it feels really, really uncomfortable, or you're like, okay, something is wrong, but it's really hard for me to talk about. Sometimes I tell patients, just write it on a piece of paper, post-it note, give it to your care team. It's their job then to investigate and figure out what they need to do to help you. It's just your job to say, hey, something's going on, and then we can kind of figure out together. So that's how I approach it. And I think that's how a lot of care team members approach it too, is we want to be able to figure out and help you live the most optimal best quality of life possible. So what can we do to do that? And then I can also talk about, so one of the tools that I really like, at least in the United States, I can't speak for our Canadian counterparts. So there's a website called Psychology Today, psychologytoday.com. That is a tool that I give a lot of my patients. So they have a lot of articles. There's a lot of things that they put out. I know they have like a newsletter and a magazine and all of that. There's actually a search function for therapists, for doctors, for psychiatrists at the top. And if you look at the very top of psychologytoday.com, there's a drop down menu, and you can filter by location, race, age, spirituality, language, specific presenting problems. So if you're saying, hey, the liver disease is really impacting me. I want somebody who has a little bit more expertise in, chronic medical conditions. That's an area you can pick. If you're like, I have some issues in the past with some depression, click depression, making sure that that person looks like they specialize in that. And then what that will do is populate a list of providers. Providers do have to pay to be on there. They have to keep their profile updated, and they are vetted. It usually comes with a picture and a short bio, or sometimes a video. So you get a feel for what that person is like. And I always tell patients, you should also feel comfortable with your care team. You should feel like they understand you, they're not judging you, and it feels like a good match. So that's another way to kind of look at their profile and say, yeah, this therapist or this provider looks like they would understand me. We have a lot in common. I'm looking at their education. I like what I'm seeing. So it's a good way to kind of get a lot of information on a lot of different providers very quickly, to kind of compare and see who might be available in my area with the things that I'm looking for. So that's a tool that I use a lot with my patients here.
I will second that for sure. And
Oh,
just in terms of
fantastic.
The Canadian option as well. And what I hear very often from people that I work with is that their care teams, their clinical teams in the hospital aren't necessarily equipped, at least here, to support the mental health piece in a way that is really accessible or sustainable in terms of sort of the ongoing care that people need. Some people are in teams that where there is that, and they're very lucky, but those are fewer and further between from my experience of working with people. So I completely agree. If you can speak to your care team about what's going on, I hope that they're hearing you, that they have access actually to people who can help you with those supports. That would be amazing. If you feel like you need extra support or different support in addition to what can happen to you for you clinically in the hospitals, or wherever your clinical team is based out of, I absolutely agree. Psychology Today is absolutely the place to go for the same reason. It's Canadian, the same thing. You can put it, you want to see somebody virtually or in person, all of those things are there. And so somebody like me who works in a private practice that and specializes in chronic disease, that some you would find me on Psychology Today. So there are lots of people like me in all over Canada, the same thing, or within your province. That's how it would work here, where people are licensed to be able to see you within your province. So that absolutely can work there as well.
Great. We are running out of time, so I just want to say thank you to Karen, Dr. Patel, Stephanie for joining us this evening. I just wanted to launch the poll questions quickly to gain your feedback on the webinar and to see kind of what you thought of the event tonight. So I'm just going to launch these here. It'll just take maybe 1 minute to complete those. Just give it about 20 more seconds.
Yeah, and just remember, these polls are very important because it does help guide us in terms of topics and things that we should do for future programming. So we really appreciate folks taking the time to do it, and better to do it now than to maybe follow up in a day or two when you've gone on about your life. So we really do appreciate your participation with this.
Yeah, perfect. I'll end those polls there. So just wrapping up, thank you again for everyone joining us today. As for us at Liver Canada, feel free to follow us on Facebook, Instagram, visit our website. We do have a lot of great up-to-date resources on different liver diseases, mental health, upcoming events that we're hosting. And if you have any questions, I know we couldn't reach them today, so you can reach out to both me, Warren, or our patient support teams, both at Liver Canada and American Liver Foundation. Just going to show the American Liver Foundation contacts as well there.
Yep, and we do have that helpline. So if you're not sure where to go on here, use our helpline. Chances are I'll be the one to answer it. So I would welcome any calls for folks that might be wanting to go a little deeper here.
Great. Thank you so much, everyone. Have a safe and wonderful evening. Thank you.
Thank you.
Thanks for having us.
Thank you, everybody.
Bye.
Bye.